Well, again, welcome to everybody. I think we all of our bugs worked out here, so I'd like to get started. And I'm thrilled to have all of you coming to our first Coffee with Gina and Friends. It's a virtual get-together for special people like you. I hope that you sit back and relax while we are going to share with you some very exciting developments at Banner Boswell Medical Center. If you're in your home or wherever you are, I hope that you're safe and that you're comfortable as you're going to watch the progress of the building of the emergency department at Boswell. Now, this is meant to be very casual and interactive, so feel free to have questions at any time. You can do that by writing into the chat room, which is down below where it says chat, and my trusty assistants will be watching for that. If you have a question at any time, they'll signal me to pause to answer your questions. So the construction on the Boswell campus is moving very quickly, and you are going to be among the first to get this behind-the-scenes peek. Many of you may have driven past Boswell and see what's going on there, and that hospital campus is going to look very, very different. We're going to take you inside in just a few moments. So to give you a perspective of where we were and where we have come from to where we are now, I'd like to share a little bit of history with you. Some of you may have heard this history before, but I think it's always a story worth telling. And then we'll hear from Dr. Scott Lapata. Dr. Lapata is an emergency department physician. He is the regional director of Vituity. Vituity is the emergency room doctors. That is their group. And he'll take you on a little virtual tour inside. And I have to just laugh a little bit because he's a very handsome man and he's wearing a mask. So for you ladies out there, I will have to apologize. And then we'll have closing remarks from our board chair, the Sun Health Foundation board chair, Todd Hornback. So let's get started. Some of you may remember, or at least have heard the story, that it was about 50 years ago. There was a group of Sun City residents who came together to form what was going to become known as Sun Health Foundation. See, there were really no healthcare services in the West Valley at the time, so this group of leaders identified a need and came together to fix that. Their sole purpose was to raise funds to support healthcare services in the West Valley. I ask you to take a closer look at that picture on the left where it says Community Hospital Fund, Welcome to Sun City, and the picture on the right, the Del E. Webb Memorial Hospital Community Campaign. You know, we still borrow some of those nuances around thermometers to show the progress on a campaign. This group was so successful passing that hat.
Video, would that be it? Unintended video?
Okay, this group was so successful in passing the hat to raise money that they were able to build and open Walter O. Boswell Memorial Hospital in Sun City, which is the picture on the left, in 1970. And then the Del E. Webb Memorial Hospital in Sun City West in 1988. Now here's a fun fact that I'm going to share. There will be no quizzes, but I think you might like to know this. That on the picture on the left, that opening day in November, 50 years ago, there were more than 5,000 people who attended Boswell's grand opening festivities. So you can see they're even wearing suits. How about that? Very cool. Okay. So to continue the Sun Health Foundation story, Sun Health was the healthcare system of the West Valley. So in addition to the 2 acute care hospitals that were supported by the community also rallied around and helped to fund the community health and education programs, the Sun Health Research Institute, many of you may remember that, the Sun Health School of Nursing. That was a great program because as these hospitals were expanding to meet the growing community needs, we needed nurses, so a way to address that issue was to develop our own School of Nursing. We had 2 hospice residences, an Alzheimer's residence, residence for special adults, home health and home care and Meals on Wheels, and the Olive Branch Senior Center. That was the healthcare system of the West Valley. You know, one of the challenges that we saw at the time, the leaders of Sun Health saw at the time, being in a retirement community and being predominantly dependent on Medicare reimbursements, that was difficult to operate this healthcare systems. So we started looking for a partner, another nonprofit partner who would share their commitment to providing superior healthcare for the residents in the West Valley. So if we fast forward to 2008, we found that partner, Banner Health, also a nonprofit organization. So they acquired the hospitals and the health systems and the needs continue to grow. So not much really changed there in meeting healthcare needs in a retirement community. The only thing that changed was that the hat that was being passed had to get a little bit bigger because things were growing. And as has been our loyal and steadfast commitment to supporting healthcare, we remain, Sun Health Foundation, remain fully committed to working with Banner as a partner to provide these healthcare needs. So a new chapter in the story is being written. Thanks to the community support for Sun Health Foundation's Generosity for Generations campaign. So this includes a $34 million emergency department and patient care transformation at Banner Boston. I'm thrilled to share with you another fun fact here is that the reason we themed this campaign, Generosity for Generations, is because we are seeing second and third generations come into the community. We see this in our life care campuses. We see this with professionals, the CPAs, the attorneys, and more. And we also see generations coming in to make this their retirement home. Part of that is due to the fact that those folks saw their parents getting such great care here, and they loved the culture and the safety of the West Valley, that they wanted to make the West Valley their retirement home as well. So that's why Generosity for Generations, those who preceded us, those who will come after us, we get to be the link between. So after 50 years, a transformation definitely was needed. You know, I recall several campaigns throughout the year where we did some campaigns to add on to the emergency department or to renovate or to change the flow. And it came time for a complete transformation of the emergency department. So you may recall that the former emergency department set up on the hill. It was up on a hill which had a ramp to get up there. And I love to tell this fun backstory about why Boswell set up on the hill with that challenging ramp for the emergency vehicles. Some of you may know that when Mr. Webb was building out Sun City, he wanted a lake in Sun City. So on the north side of Thunderbird, they started digging that lake. And because it's expensive to move dirt, they decided to dump the dirt from the lake dig on the south side of Thunderbird. So it kept accumulating to all of a sudden we have this little hill right there. Well, when Mr. Boswell and Mr. Webb came together, Mr. Boswell was offering a sizable contribution to build the Boswell Hospital. He said that he wanted the Boswell Hospital to be the beacon of healthcare on the West Valley. So that's why they built that on that little hill. Wasn't very convenient for automobile or emergency department traffic, but that's the story that we've heard. So it was time for this transformation now. And this new transformation will accommodate the West Valley growth and the expansion of healthcare services. You know, nearly 80% of those who are admitted into Boswell come through emergency. More than 50% of those have cardiac issues. So when this transformation is complete in November and open to the public, there will be a heart focus in the middle of that, and that will be very, very exciting. This transformation will increase the capacity to more than 65,000 patient visits a year. Currently, they're at anywhere from 40 to 46,000 patient visits each year at Boswell. This will expand that to accommodate the growth. They'll add 33% more patient beds, and the design of the interior will accommodate for a different kind of flow and movement that is needed to care for those who are coming in through the expansion, and enhanced triage rooms, treatment areas, and observation areas. It's really going to be amazing. So we've had several construction milestones that I'd like to share with you at this point. We did groundbreaking on April 10th of 2019. Now, if you look at this picture, I'd like to point a couple things out. On the very far left, you'll see Debbie Flores, who at the time was Banner Boswell, Banner Del Webb Medical Center's CEO. Next to Debbie is Joe LaRue, our CEO, the Sun Health CEO. Next to Joe is Todd Hornback, and you'll hear from Todd in a few minutes, but he's the chairman of the Board of Trustees for Sun Health Foundation. And then there's me. And next to me is Sandy Fell, who has been a friend of Sun Health for many years, and she has served on all of our boards and led as chairman of most of the boards, or perhaps all of the boards. She's just been such a great friend to the foundation and leader in the community. And then we have Lee Peterson, the tall guy on the far right. So Lee was the CEO of Sun Health for more than 35 years. And if you look closely, you'll see that the shovel that Lee has is different from the other shovels. That was the shovel that was used at Boswell's groundbreaking in 1969, more than 50 years ago. And it hangs right outside Joe LaRue's office. Another little fun fact. Okay, this was the fun part. You know, I mentioned that emergency department was on a hill. It was the beacon of healthcare in the West Valley. And so it was decided in this transformation that the emergency really needed to be on street level. So we had a deck demolition in May of 2019. And as you can see, there was a lot going on when they demolished that deck. And it was kind of emotional for some of us who had been accustomed to that deck for the emergency department. A year ago, construction begins. So the deck is gone. They have all the staging areas and everything that's going on there. So construction begins in the summer of 2019. So then reaching new heights. You know, these beams and these posts went up so quickly, and that was the framework for the emergency department. I want to be sure that I let you know, you'll see pictures of this in a few minutes, but the emergency department will be the foundation, if you will, for another tower which will sit on top of emergency. So the round towers that we have seen for so many years will be repurposed at some point, and then I'll show you, you'll see a picture where the entrance for emergency and Boswell Medical Center is going to face east, and it's very, very interesting. So again, you know, in construction, there's this major beam that goes up on top, and you'll see our raising the beam in just a few minutes. But as is history and as is culture, when you're doing a construction project of this magnitude, we all get to sign the beam and put our notes on thanking the support from the community for making this happen. So you'll see our very own Bonnie Olson right there. She's signing the beam. And then on March 3rd of 2020, I just got goosebumps on this. March 3rd of 2020, we had two major milestones. Topping out ceremony, which you'll see that we're raising that beam into this construction site. And then the Generosity for Generation campaign reaches 50% of the goal. A lot going on, March 3rd, 2020. And then this is kind of difficult to see in this picture, but I'll show you another one in a minute. This will be the emergency department entrance. There will be two entrances, actually. One of them will be for ambulance traffic, and then a separate one further away and a little further north in the construction site will be for patient and automobile traffic to go in that way. So really, really great way how they're going to be able to triage and send the traffic through this way. So now you see we have a better view of the emergency department is on the ground floor, and then this tower is going above that. And that will be the patient care towers. Again, those round towers that we've been looking at for many years will be repurposed at some point. Now, this is a very exciting fun fact on this. This is innovative in the state of Arizona and maybe beyond, but this construction project has been very unique because if you'll notice, there is no scaffolding on this construction site. So what happens is the panels, you'll see the panel, this blue panel over here on the left, we call them the flying panels because the panels are constructed off-site, and then they're driven over and they're actually staged across the street. And then the crane picks up the panel and brings it over to the construction site, and it's like Legoland, drops it right into the framework of that construction site. So that is unique for several reasons. With no scaffolding, the safety issues, there's no safety problems at all. It's a very safe construction site, which is very important with a project of this magnitude. This is also very cost effective. And then it results in superior, it's cost effective in terms of dollars and also in terms of time. That's why this project is moving along so quickly. So, you know, some of you may have seen our pictures on our website or in our emails about the flying panels. That's exactly what we are referencing. And I've been at the corner of 103rd Avenue in Thunderbird in my car, and I'm watching these panels fly across. It's just amazing. They do it early in the day. Flying panels. Okay, so this is a rendering of what the exterior will look like this fall. If you look closely, you'll see the ambulance entrance is on the left, which will be south, and the emergency entrance is on the right, which is a little bit north. So you may recall 103rd Avenue intersect with Thunderbird, and then right next to that was just west was 103rd Drive, which was the entrance onto the campus that you came to support services and the east entrance. So this actually, the emergency department straddles 103rd Drive, which means the entrance to this campus will be on the east side of the campus, and you'll come in from 103rd Avenue and 103rd Avenue and Thunderbird. So again, it looks very, very different, Banner Boswell Medical Center. And you'll notice the helicopter pad right on top there. Hope you can see that as well. Right now, they have a temporary helicopter pad just south of the construction site, but it will be on the top of the tower. And then this is a rendering of the interior. It's going to be, I don't know if any of you have been in the emergency department at Boswell recently. The interior doesn't look like this, but it will. It will look like this in very short order. So it's beautiful. It's calming, it's soothing. They've chosen colors and design that will be just lovely. Okay, so now I would like to introduce Dr. Scott Lapata. He was kind enough to take some time out of his very, very busy day and do a virtual tour. So I'm going to ask Joyce to click on the virtual tour so that we can take a walk inside.
Hi, it's Dr. Scott Lapata, Regional Director for Vituity in the Emergency Department at Banner Boswell. And I wanted to give you a quick video to show you what your donations have been used for. And as you can see, this is our new emergency department under construction. This is the area where the doctors and nurses and other support staff will be sitting. And as you can see, that's surrounded by the various exam rooms, where hopefully you don't need to come, but if you do, you'll be much more comfortable than you have been. And recently this week, they're laying the flooring in, so you'll be able to see what that's going to look like. And if you look down the hall, you can see where the ceiling tiles and everything have been completed, and they're getting ready to put paint in. So everything is on schedule for an opening on October 6th. And again, we in the Boswell Emergency Department really appreciate all of the donations and hard work and effort that you, the community, put in, and this is the result of all of that. So we thank you again, and again, hopefully you don't have to come see us, but if you do, it's going to be a great space.
Okay, thank you, Joyce. So Dr. Lapata is very passionate about his work. He loves emergency medicine, and we asked him to just do a quick video because once he gets talking about emergency medicine, he just gets into his zone and he just loves that kind of work. Which I should tell you also that when the community supports a project of this magnitude and provides the philanthropy that will help with expansion, that will help with equipment acquisition, that recruits and retains the best medical professionals that you can imagine. So it's just such a great partnership with the community and with these medical professionals, because they do love to serve this community. And by the generosity of generations to build these wonderful buildings, that's what keeps these docs here. Many of them have been here for quite some time. So the excitement continues to build, and we're going to have several of these videos because, as I mentioned earlier, the project is moving so quickly that it looks different on a Friday than it did on a Monday. And so we want to keep you up to date. So you'll be hearing from Linda or Joyce to get invitations to additional copies so you can see the progress. And we'll have different folks, different banner leaders who will be leading those tours. And so you get a different vision each time that you join us for this. We're planning for a pre-ribbon cutting on the 28th of August. Now, there's been discussion about on-site tours for the VIPs, like people who are in our room today. But we want to be very, very careful about protection and social distancing and masks and all of that. So we're planning for on-site, but stay tuned because that may change. You know, your safety and your health is our first priority. October 6th will be the first emergency department patient will be admitted, October the 6th. And then events to celebrate this, we will be honoring the Heroes with Heart at our gala on November 7th. That will likely be a virtual event where some of our very special healthcare workers will be honored. The grand opening of the campus on November the 16th, which will celebrate the 50-year anniversary of Boswell, almost to the day. And then we will have a Walk for Women's Health on December 6th in Surprise. And that will be a very exciting event too. You know, we have all of these young families who use the nesting place at the Louisa Kellum Center for Women's Health at the Del Webb Medical Center. And those families want to support the expansion of some of those projects at Webb. So we're going to do a Walk for Women's Health on December the 6th. So stay tuned for more information about all of this. And please invite your friends. So now I would like to introduce Todd Hornback, the chairman of the Sun Health Foundation Board of Trustees. Todd has a few closing remarks. Thank you. And thanks so much for joining us today.
Well, hello, everyone. It's really nice to be with you today. Well, at least virtually. I sure wish we could be in the same room together, but in the meantime, isn't it nice that we have this kind of technology that can bring us together, help us connect and stay engaged. And like today, we learned a little sneak peek behind the scenes about what's happening at Sun Health. And of course, we're just extremely excited about our new ER at Banner Boswell, about to open in just 3 short months on October 6th. And what's so reassuring about this project for us is that we know that it will dramatically increase Banner Boswell's capacity to meet the medical needs of our growing community, to provide that superior health care right here at home, right here in our community. And in fact, we're confident that this is the most innovative, indeed, the most patient-centric emergency room anywhere in the Valley, and it's coming right here to our community. And we have a lot of people to thank for that, of course, and it's really been generations of generosity, of giving, of community leadership, of philanthropy and volunteerism that have gotten us to this point. And so on behalf of the Sun Health Foundation Board of Directors and all of our staff and volunteers across the enterprise, thank you so much for all of your commitment and dedication to our mission over the years. In fact, it is our Generosity for Generations campaign that has made all of this possible. So again, thank you so much. I do want to provide a quick note, like I like to do. If you're in the unenviable position of having to make a decision right now during COVID about accessing care, please don't hesitate. I can assure you that our good friends at Banner Boswell and Banner Del Webb are prepared to meet your needs, even in this environment. So please make sure that you're taking care of yourself. And then lastly, I just have a very special invitation for all of you. I'm going to look at my notes to make sure I get it right. Banner Boswell will be celebrating another milestone at the end of August, a pre-ribbon cutting event. And it's, of course, a turning point in the construction for sure. And you're going to be among an exclusive few to get a behind-the-scenes tour before a grand opening. And so more information is forthcoming, so please make sure you look for that. And again, please understand that all of the stringent protocols by the CDC for health and safety will be assuredly in place. And so again, thank you so much for your participation, your involvement, your commitment to Sun Health, and really your giving and your generosity for generations. On behalf of the board, thank you. Have a great day.
Well, Todd, we're so blessed to have Todd as our leader, and he's just been so committed to this project and to the community. So again, our thanks to all of you for being here. Are there any questions that anybody would like to address? Or you can certainly call me with questions. I'm happy to take those questions and get you connected with who could answer them if I cannot. And it's always such a wonderful learning curve in a project of this magnitude. So we thank all of you for being here today. We appreciate your patience during some of our technological blips, but I think we have that fixed. Look for more information for upcoming videos. This will be posted on our website in a few days. We wanted you, however, to have this behind the scenes look. And so invite your friends to take a look at this. If you have a minute to drive by Boswell and see what's going on there, and we will keep you updated with all the great news about this amazing healthcare system in the West Valley. Please stay safe, stay well, and try to stay cool. Thank you. Bye-bye.